Welcome to Toledo Clinic TV. Our guest for this segment is Dr. David Kouba, a dermatologist. Thank you for being with us.
Thank you for having me.
They're going to spend the next few minutes now talking about skin cancer. What is the best way to prevent it? What can we do to prevent skin cancer?
It's a really good question. There are a lot of different ways to prevent skin cancer, and we like to start early in life with patients. First of all, the most obvious things are avoiding excessive sun exposure, because that is the most common cause of skin cancer. And that starts with really the obvious things of avoiding excessive sun with wearing of sun protective clothing, sun protective hats, wide brim hats, sunscreen use. That's probably one of the most underutilized forms of prevention. So an SPF 50 sunscreen applied 30 minutes before going outside, and probably the most important thing is reapplication every 2 hours while out in the sun.
We forget to do that, don't we?
We do. You know, I have a lot of patients come to me, and they're boaters or they're golfers, and they say, you know, I put sunscreen on before I went out fishing, and then I got a sunburn anyway. And the problem is, after about 2 hours, the sunscreen is kind of useless. So unless you're reapplying it every 2 hours, you know, you're out in the sun for 8 hours. 6 of those are without any protection. So repeated application is very important.
So let's say a patient comes to you and you do testing and you determine that there is a skin cancer diagnosis. How do you treat that in your office?
So there's many different ways of treating skin cancers. So it all depends on the type of cancer and the location. So I'm a Mohs micrographic surgeon, and that is the gold standard technique for the removal of skin cancers on the head and neck, hands and feet, digits. So that's a procedure that we do in the office under local anesthesia. So patients are awake the whole time. And we bring them into the office, we numb the area, and we remove the cancer in just a few seconds. It's painless. And then the patient waits for about 20 or 30 minutes while we use our in-house laboratory that's in the office to see if all the margins are clear. And once the margins are clear, we perform the plastic surgery that same day in the office.
And if you needed to go back, you could do that right then and not have to have another visit.
Exactly. So if we have to go back, we take a little bit more, only where we have to. We use the micrographic mapping to guide us, and that allows us to take only the actual cancer and none of the normal tissue, which really minimizes the size of the defect that we create, and then, of course, makes it easier for us to do the reconstruction.
So what is it that sets your office apart from other dermatologists? So,
you know, we've really been the premier skin cancer office in Northwest Ohio and Southeast Michigan for quite some time. We've been with the clinic for 15 years. All of our providers are extensively trained, and we provide the best care for patients.
All right, thank you so much for being with us.
Oh, thank you for having me.
We'll be back in just a minute.